Let me, first of all, thank you again for the tremendous work you're doing in saving lives. And I think, sometimes people are very critical of foreign aid. They should know the robust efforts you, the administration, the Congress, in a supportive role, is undertaking to save lives of the most precious and the most vulnerable people, particularly women and children. So, again, let me echo what we all said, I think, in our openings, just how grateful we all are for the work that you're doing for people who have been displaced, the refugees, the IDPs, women and children who are being savagely attacked, and women who have been raped. I'll never forget, years ago during the Balkan Wars, I had hearings with women who had been raped, and one, she was so traumatized, and she thought she could handle speaking what other women were experiencing during the Balkan Wars. Bianca Jagger was actually here as well, speaking to that, and she froze. She couldn't speak. She had been so utterly traumatized, and I know you're helping women who have been so horrifically violated. So thank you for that as well. I do have a question, Secretary Clements, Deputy Assistant Secretary. You mentioned on regards to vaccination, 2.9 million children require life-saving vaccinations. I wonder if you could break that out a little bit. They have not gotten it, or some of those have already received it. What vaccinations are we talking about? I've always believed that vaccinations like antibiotics as well as anesthesia are among the wonders of the world in terms of how they mitigate disease and pain. So the question would be 2.9 million. What are they lacking, and what is being done to try to get those vaccinations to them?
Thank you very much, Chairman Smith, and thanks for your kind words. I have to say, to follow up on a point that the ranking member made before he left, it is a moment to be proud as an American in terms of what the U.S. taxpayer is doing to help us provide this kind of humanitarian aid to so many people in need, and we deeply appreciate that. In terms of the vaccination question, and we can take that back and get some more granularity for you, certainly, great. But between USAID and the State Department's humanitarian programs, both inside Syria as well as in the neighboring countries, very strong network of health providers, and obviously through UNICEF and through the World Health Organization with a large number of implementers, there has been a great effort underway to try to vaccinate as many kids as possible. I can speak more to the refugee side of things in terms of in the neighboring countries, but it is a core part of the health services that we're providing every day.
Thanks for that question. It's important. I mentioned the polio vaccine, and that's an indication that they are actually able to get out to a lot of places that you might not think they could. It's still not perfect, and we continue to try to get out as far as we can. Last week when I was in Jordan, I visited one of our implementing partners, and they've been able to establish and are continuing to expand their network of field hospitals and clinics in opposition-held areas from across the border. And that's another way we can start to push out the reach of health care, including vaccination. But that's a critical issue, yeah.
Let me ask you a question with regards to, we all know from history that the Spanish flu epidemic, of course, it had nothing to do with Spain, but it was a terrible pandemic. Following World War I, infected some 500 million people. The estimates are upwards of 50 million. Some say more, some say less. Actually died, 5% of the world's population. Health services have been disrupted with more than 73% of hospitals, 27% of primary health care facilities, and 65 to 70% of the pharmaceutical companies out of service. A couple of weeks ago, I met with Dr. Peter Hotez, who has been here before to testify. He is the leader on neglected tropical diseases, and as a matter of fact, I have a pending bill that we wrote with his very, very insightful suggestions on what it should look like. But I know he has said that he has concerns that a pandemic could arise out of Syria or the region. War conditions, lack of sanitation, cholera, all the other attendant problems. The longer this conflict goes on, and again, the Spanish flu occurred near the end or at the end of all of the bloodletting in World War I. And I'm just wondering what your thoughts might be on that. You know, I know we're far more advanced than they were back in 1918, but when we and people like you don't have access to contested areas or healthcare workers are being killed simply because they're trying to assist, it makes it harder and these things could happen. What's your thoughts on that?
I wonder sometimes whether or not you've read so much into my bio that you know that my husband works on pandemic preparedness at USAID, actually. In terms of this, obviously, it's a huge concern. You know, with the war that's raged on now for over 4 years, the concern in terms of the health system inside Syria losing 30 years in that time at least. And as you well know, the medical facilities and the personnel delivering those services have been under attack. And until very recently, actually, even in some of the cross-border, cross-line operations, some of the partners we're trying to get aid out to could not put any kind of medical help into their kits, into the aid that they were delivering in communities. So it is a real concern. I think we do the best we can in terms of the areas we can access. I think our support systems are much stronger in the neighboring countries, in Jordan in particular, Lebanon, and the Iraqi Kurdistan region and so on, in terms of what we're trying to do. And obviously Turkey has done a tremendous amount on the health side. But that's something that we need to continue to work on to try to prevent what you've just outlined. Thank you.
And I might add, it's all the more reason why it's important, this UN resolution last year, 2165, being able to work cross-border so organizations like WHO then can move across those lines of conflict, and we need to continue to support that. The other maybe helpful mitigating factor is that Syrians are used to getting vaccination, and they demand it. Okay, some refugees we work with or people in underdeveloped countries are not used to it. They are used to it, and so they're looking for vaccination, and that does help mitigate some of the problems. Yeah.
Ranking Member Deutsch.